All right, everyone. Thank you again for joining us this morning. And for those of you who have stayed with us this morning, we're going to be taking your questions here in just a moment. Leader Naheed Nenshi is joined by Sharif Haji, the Shadow Minister for Primary and Preventative Health, and Janet Aramenko, the Shadow Minister for Mental Health and Addictions. Mr. Nenshi will begin with a statement.
Well, thanks, everyone. There is a lot of news out there, and I'm happy to take questions on any topic, but I particularly want to talk about some reporting in today's Globe and Mail. The Globe and Mail has confirmed that bureaucrats have been asked to prepare legislative amendments allowing for American-style two-tier health care here in Alberta. Indeed, according to these amendments, Alberta is willing to go further than any province has gone since the beginning of Medicare, and allowing doctors to work simultaneously in the private and public systems. So what does that mean? It means a doctor who has limited time to see patients will now choose whether she wants to see a patient who can pay more on the private side or a patient for whom she'll be paid less on the public side. This is American-style medicine. We know it doesn't work. And most important, the Premier did not campaign on any of this. During the campaign, she said, no one should pay to see a family doctor. And now she's opening the door to exactly that. We're used to this Premier throwing away her ethics, her morals, her promises, and her principles. But this is too much. And it's not going to work. It's going to increase wait times within the public system. Imagine you are at Canadian Tire getting ready for your winter tires, and there is a huge lineup for the cashier. And the manager says, no problem, I'll open a second lane. So they open a second lane, creating two lineups, and there's only one cashier covering both lineups. It doesn't actually help, and it makes the cashier miserable. But here's the thing. This is not about winter tires. This is about your health. This is about your right to health care. Nobody in this government campaigned on this. Albertans don't want this. So I'm calling on the Premier today to say, if this is your plan, 180 degrees opposite from what you campaigned on, I'm willing to see if Albertans support you. Dissolve the legislature today, call an election on the topic of privatization of healthcare, and let's take it to the people. Happy to take questions.
Okay, we're going to start on Zoom, and our first question comes from Emma Graney from the Globe and Mail. Emma, go ahead. There you are.
I guess off the top, do you have any idea yet about how these changes or these proposed changes might intersect with the Canada Health Act?
Well, you know, I am relying, of course, on the reporting of your colleagues at the Globe and Mail, but that's certainly a question that is absolutely top of mind here. You know, certainly the Canada Health Act does not prohibit private delivery of care, and the UCP and other provincial governments have exploited that loophole. However, having the same physicians operate simultaneously in the private and public system, particularly if we're talking about family physicians, appears to be a step that no other province has tried, and I suspect that the federal government will have a lot to say about this.
Do you have a sense about how easy it would be to undo something like this were it to be brought into law?
You know, that is a question I ask myself every day. What are they doing that is irreversible? What are they doing that we can fix when we're in government? And the point is, we have to fix it. We cannot allow their incompetence and or their malice towards the public healthcare system to have permanent effects. But the only way to fix it is to elect a new government.
Okay, thanks.
Thank you for that, Emma. Going to the next person is Janet French from CBC. Janet, go ahead.
Good morning. I don't know if this is an Nenshi question or one of the health critics' questions, but what do you know about why other provinces forbid doctors from working in both private and public systems?
Because they believe in universal health care. Because even conservatives, even Ralph Klein backed down on privatization of the healthcare system when he was the Premier. Conservatives across the government know not just it's an electoral third rail, but it's the wrong thing to do. The U.S. spends far more than we do on health care for worse outcomes for most people. And we know it doesn't work. We know that it leads to bad healthcare outcomes. And other governments have been smart enough to know that the public doesn't want it and it doesn't work. Yet this government, as always, forges ahead, not caring about any of these things, caring only about the Premier's ego and her own political survival with her own base. And her own base is going to hate this, by the way.
I want you to tell me why you think her base is going to hate this, but my actual follow-up question was, devil's advocate, what if it did, because it would make Alberta a unique jurisdiction for health policy? What if it did attract more people, and then you didn't necessarily have that cashier toggling between lanes if you had more cashiers to work with?
If that were the case, awesome. There is no evidence that that actually works. No healthcare professional who is working in the public system today, even though they'd love to make a little more money, even though they would love to be able to operate that way, wants to deal with the administration, the billing systems, all the things that it's going to take. So there's never been any evidence that even in Quebec, where they have a much more robust private system, they don't have a ton more doctors there either. But what it really means is for those who can afford to pay, those who cannot afford to pay, that their wait times will get even longer because there will be fewer people operating in the systems. There's no evidence of that. And these problems, of course, are particularly acute in rural Alberta. They're particularly acute in smaller centres. And that is where the Premier's geographic power base is. And she's about to make life much, much worse in terms of health care for people who live in Vermilion or Lacrete, and they'll be able to see through that.
All right, we're going to come back into the room now. Sean Amato from City News.
So I'm seeing some reaction to this. Some people are saying this is being tried in Quebec and it's not working very well. There's also a think tank in Quebec that says actually it's being done in Norway and it is leading to better health outcomes for people. So it seems like there's a lot of sort of mixed expert opinion on this matter. What are you hearing and what do you make about those differing opinions?
We know it's not working well in Quebec. We know that it is not leading to more people having primary care practitioners. But we also know that this government never listens to experts. This government never looks at case studies. They just forge ahead with their ideological changes with no thought to the implementation of these things or how they will work. Let's talk about the transports ban. I don't think if they had said when they ideologically made the statement about girls' sports, now every girl over 12, just the girls, not the boys, have to prove their sex. I suspect a lot less people would have supported that bill if they knew that's what it meant. So in this case, look, if the government wants to table amazing evidence, if they want to start a consultation process, if they want to take it to a referendum, if they want to call an election, I'm in for all of that. But this government's doing none of those things. They're gambling based on dangerous American-style rhetoric, just like they always do.
Leaked memos can be a little tricky. It was a couple months ago that you guys released a leaked memo about changes for drug coverage
Yeah,
for
and we
seniors.
stopped it, didn't we?
Well, the government said at the time, no, we never actually intended to do that. That wasn't part of
Sure, they
it. So
never intended to do it until they were embarrassed by the leaked memo.
I guess the question is, how much weight can we put in leaked memos? Because
Well,
sometimes it's not actually something the government does.
Unlike the colleagues opposite, we actually have experience in how government should work. And if you're at the point where you're getting bureaucrats to spend incredible amounts of taxpayer resources writing amendments to legislation, that's not a trial balloon. That means you're ready to go. And who knows, they might get embarrassed by the leaked memo and back off, just like they did with the last leaked memo. But let's see what they have to say. I'm waiting to hear the Premier's response. But I will say the Minister's spokesperson's response sure as hell made it sound like they were ready to go.
All right, I'm going to take another quick scan of Zoom. We have lots of people on the line, but nobody has their hand up right now. So last call for questions. And, Emma Graney is back from the Globe and Mail. Emma,
All right, you can
go
do
ahead.
it, Emma. It's your paper that broke the story. We'll give you some credit here. Go ahead.
Thanks very much. Much appreciated. I'm just curious whether you think this plays into any of the other revelations that we've heard recently around healthcare and around AHS and around any of those other issues that are more broadly been reported about the UCP government, and I'm sure you know what I'm referring to there. But I'm just curious whether you see any tie-in with any of that stuff.
Yeah, I mean, it's all about corruption, chaos, cuts, that we're seeing through this government, and the biggest one is chaos. There's not one person in Alberta who would tell you that the healthcare system is better today than it was 6 years ago when Danielle Smith took over. She said she would fix it in 90 days, which was an unbelievably dumb thing to say. It shows she did not understand the complexity of the system that keeps people alive every day. And so they're just throwing spaghetti at the wall because they have no idea what they're doing. Their entire healthcare reform is a make it up as you go along. We now have 9 new organizations to do what one organization, AHS, did before. Each have their own CEO, their own management levels, and more of them seem to crop up every single day. And yet, there's no plan to hire a permanent medical officer of health. There's no plan to hire a permanent AHS CEO. AHS is operating with no board where the interim CEO reports only to himself. This is a disaster. And it is not just hundreds of billions of dollars of Alberta money that this government has no idea what they're doing with. It's people's lives. We know people are dying on the wait list for cancer treatment. We know that people are dying after they leave the emergency room because they're not being seen. We know people are very, very ill because there's no screening because they don't have primary care practitioners. A million Albertans don't have a primary care doctor. This is not fun and games. This is not a playground for the Premier's ideology. It's time to get serious, work with experts, work with people who work in the system, and get healthcare to Albertans that need it.
So what would you do to improve healthcare then? I know I'm giving you a bit of a platform here, which is not my intention, but I mean,
Ready.
going back to some of the questions in the earlier press conference about actual solutions,
Yeah.
what does help?
Well, you know, it is dreadfully complicated, and that's why for a year now I have assigned one of my MLAs, Dr. Luann Metz, who is not just an MLA but a world-renowned neurologist, to actually talk to experts and to talk to people who work in the system and develop a blueprint for the future of healthcare. We've got to get away from making it up as you go along to idea, data-tested, expert-driven, and frontline approved reforms that are really going to make a difference for patients by putting patients at the center instead of putting ideology at the center. So we'll be revealing those slowly over time, so stay tuned. But the point is that we're trying to go through a data-driven approach that really puts experts first and the patients at the center of the model.
All right, everyone. This concludes the news conference. We're looking forward to question period at 1:50 this afternoon.
Should be a fun one.
Thank you, everybody, for joining us. Mind how you go.
Thank you.